It didn't.
It worked. All right. Hey guys, this is Dr. Keo, and I'm here today with Rachel Amiri.
Hi.
Thank you so much for joining us.
Sure.
This Facebook Live is talking all about how to know when we ovulate. And before we get into that topic, we're actually going to start talking about hormone-free birth control and all the different methods. And I'm actually going to go ahead and read your bio so everybody knows. Rachel Amiri is a certified Creighton model fertility care practitioner. She has taught this method of natural family planning for the past 5 years at Little Flower Family Medicine in O'Fallon. Rachel used the Creighton model for over 10 years with her husband Dan, both to avoid and achieve pregnancy, as well as to identify and treat health problems using NAPRO technology, which is natural procreative technology.
Yep.
Okay, interesting.
We'll talk about it.
Cool. Rachel believes that understanding our bodies and fertility is an integral part of being empowered to make positive decisions for our own health, and she loves supporting women in gaining that understanding. So thanks again for joining me today.
I'm happy to be here to talk to you about this.
Awesome. So before we get into it, I just want to kind of make note that this is a very personal topic for a lot of us. So it might not be appropriate for all people. All people listening. So if it's not, you don't probably want to watch it, but it's also, if you're like me, who has been messed up by birth control. I was on it when I was 16 and I got pretty screwed up by it. Then this is a really important video for you to watch and start to gain some more understanding of what birth control is and how it impacts us and some of the other natural options that are out there. So, but really we're here to talk about how to know when you ovulate. But before that, I want to mention, again, Dr. Emily Hecker and I, the main reason that we have created Fertile in St. Louis is really to help people become educated. Like that's really why we're doing this, is to just educate people in the community in the St. Louis area and beyond on, health, fertility matters, all of it. And there's a huge train wreck that's coming, and you see this, I'm sure, in your practice, but every day, I probably, every single day I've talked to a woman who deals with hormonal imbalance. And hormonal imbalance is so prevalent, and these women, they're coming in and they're dealing with all types of symptoms, and what we find out is, maybe they're on birth control or they were on it for
A long time.
like a decade,
Yeah.
right? So, when young girls hit puberty and they start to have health issues like, major mood swings and acne and painful periods, they have heavy flow, maybe their periods are really irregular, all of that, what do? Like, we go to the doctor and
Ask for help.
And
Yep.
then we're prescribed birth control.
Yep.
Like
That's the Band-Aid.
that's usually the only answer we get, and that is like putting a Band-Aid over your check engine light in your car, right? Because
now I can't see it. Yeah.
right, it's and it does help to regulate, if you will, your hormones, but it does that by shutting down feedback loops in your body. So basically, like cutting off that communication from your brain down to your endocrine organs. And so of course it's going to take care of a lot of your symptoms, a lot of those terrible symptoms that we get from, that we can get with our cycles.
Right.
But it's not addressing the root cause of why we're having those issues. And you see that, I'm sure.
And then often after you come off of the hormonal birth control, you will experience all of the issues that you had before you went on it that were never treated, and they may have worsened over time.
Right.
Yeah.
Or, they've compounded because it's been years. Right. So that's what we see too. And Emily sees this, I see this in my practice as well. And so we have such a big issue to deal with, when that woman finally does come off birth control, and helping her get her body regulated so she can even start to think about conceiving a baby. So really, we do Fertile in St. Louis. We've created it to educate all people. Whether you're a man that's been told you have low sperm count, you've been diagnosed with endometriosis or PCOS, maybe you have painful periods, maybe you're trying to get pregnant right now, or maybe you're already doing fertility treatments. It doesn't matter who you are, where you're at on your journey. We just want to educate you where you're at And also, parents that are watching these videos and learning about what we're doing, think about your children. This stuff starts super young. What are we feeding our kids when they're babies, when they're toddlers, when they're children? Are we exposing them to endocrine disruptors? All of that stuff makes a huge impact, and we see it most when we hit puberty and we have those massive hormone shifts, right? Also, another example is menopause. Depending on how our health was during our childbearing years, our years of menstruating, will determine how going into menopause. Do you sail into it, or is it like a living hell?
Right. Is it ups and downs?
Right. That all makes a difference how healthy we are during those other times. So, with that, just from my own personal story, I had to go on birth control when I was 16. I didn't know any better. That's what everyone did. Terrible menstrual cramps, like flat on my back, for days. And I didn't really know what else to do. So I went and got on birth control. I put myself on it. And it made a huge difference. Like, it did actually, regulate and help, right? But it was short-lived. For me, it only worked for about 4 months.
Wow.
Did you ever?
I was not on the pill.
Okay.
When I was
Smart.
young.
So that's really good. But I didn't know what else to do. So it helped me for about 4 months. And then at about month 5, I noticed the cramping was coming back. And month 6, it was completely as bad as it was before. So I went off of it, and then that's actually when I had more health issues for the, I'll keep the story really short, but for 5 years, almost 5 years after I got off, I didn't even have a cycle. Wow. So it really messed me up. That's a pretty extreme case. I know it doesn't necessarily do that to everybody. But what else was interesting when I was on birth control is I never had UTIs before I went on birth control. I also had massive mood changes and mood swings, and those are just some of the more minor side effects.
Right.
There's also
There's very serious side effects. I mean, they're rare, but women can have blood clotting issues, and strokes have been associated with some forms of hormonal birth control, but the ones you're describing are much more common too. It affects the gut microbiome, we know. It causes nutrient depletion, so women can really experience the effects of that after going off of it.
Wow. Yeah, I was thinking the same thing, like stroke, even some cancers potentially.
Right. Yeah.
So those are more serious, obviously, but and not as common, but still happens. So I feel as though a lot of women don't feel like the pill is foolproof, right? It's easy to do. You
can take it daily,
right.
It fixes things, right?
Right.
And that's what your doctor offers you.
Yes.
They don't often have alternatives. They don't sit and ask you, well, what kind of pain are you experiencing? When is it happening? And really investigating what's causing that. Instead, they're saying this should alleviate that for you, and then you can continue to have those symptoms later.
Right.
Yeah.
And there's also other forms of birth control that you don't even have to take a pill.
Right.
Like the implant.
The implant, the
IUD,
depot shot,
Depot, and we're just. You don't have to think about anything.
Yeah.
So there's a level of convenience that we all really like, but at what cost does that take?
And do women fully understand that cost when they're getting it?
Sure.
Yeah.
I didn't.
Right.
I was never told any of this when I was put on birth control. I was told this was going to help me, and I wanted to help myself.
Right.
So I just did it. And luckily, I was only on it for 6 months. I think about, oh my gosh, what would have happened had I would have been on it much longer. So that was just my personal experience, and everybody has their own experience with that. I talk to women a lot, though, they don't feel as though these methods that we're going to talk about in a moment are really doable for them. I don't know if that comes down to, I think it's lack of education on the methods. They can't be 100% effective. There's a lot of fear, I think, in not taking the pill, or doing something that's
or it's
easy.
all on me and my understanding and my decision and my understanding of my cycle, and women don't have the confidence in that necessarily based on what they've been taught their entire lives. So really the role in teaching and learning these natural methods is to help women have that knowledge and understanding of their body where they can confidently say, I'm fertile today or I'm not fertile today, and then they can make decisions based on that. So it really is empowering information that women aren't given at younger ages, and you can do it. It's possible to do it. Many women do. We just need to talk about it more and talk about how to use it effectively.
So you think it's more that it's just not we're not given those options. It's not talked about much.
It's not. I mean, the CDC says they have their listing of effective birth control methods. You know, IUDs are at the top, and then down here at the bottom near withdrawal is fertility awareness, and it's 75% effective is what they say based on kind of their overall survey type of studies. They don't talk about these modern methods that we're going to talk about that are based on women's own symptoms through their cycle. Often people think of fertility awareness as, the rhythm method, we're counting days, but it really can be effective if you're looking at the actual signs of fertility and understanding what those are and how they indicate when you're ovulating. So
great.
Yeah.
So we're going to get into that next.
Yeah.
Oh, I lost my notes. 1 second.
Screen went away.
Screen went away. Okay. So we're going to talk about, fertility awareness methods, natural family planning, and like you just said, like a lot of women say it might not be effective, but they might not be doing it.
There's so many misconceptions people have about how fertility works. Like they think they can get pregnant anytime during their cycle. They're just ovulate spontaneously. But really there's reliable science of how fertility works where we know you ovulate once a month. There are clear signs that indicate when that's going to happen. And then these methods are based on those signs. So
great.
I'll let you.
Okay, so you have to really maybe do some research and figure out learn about the methods.
Yeah.
There's multiple methods, and kind of see each has pros and cons, and see which one is right for you.
What you think is going to fit your personality and your background. Yeah.
Right. So the first one I have is the rhythm method.
Yeah.
So that's kind of an old and I think outdated almost.
Pretty outdated, yeah.
Counting days, right? So it's like our apps on our on our
Your
phone.
counting days. They have a formula to do it, but yeah, it's pretty basic. It's based on the idea that you will only ovulate once a cycle, and then there is a fertile window kind of built into it. It was a great development when they came up with the rhythm method, but now we know that there are clearer signs, and it doesn't work for every woman because there can be natural variation in when you ovulate. So we need to actually look at symptoms and not just count on the calendar.
Gotcha.
The thing is, there's all these apps now that women think are really high-tech ways of tracking their period and finding out when they're fertile, but they actually are just the rhythm method calculation. So if you're ever using an app and it asks you to put in your period date and then based on that alone predicts when you are fertile, that's the rhythm method.
The rhythm method.
So if that's not working for you to try to get pregnant or to avoid getting pregnant, then that's why there's more effective methods out there.
There's other things to look at.
Right.
Okay. So the symptothermal, that's a common method. It's you're tracking 3 different signs: your temperature, your cervical position, and cervical mucus. So that sounds like that's a lot of good body cues.
Yeah.
So that's another good one.
It relies on cross-checking, really. So cross-checking would mean I'm tracking all these signs and I'm going to see that they all indicate that ovulation has passed or is coming. So some women like using multiple signs because it gives them more confidence in using it. So,
yeah. Okay. And cervical position, that's an interesting one. So you're looking at whether the cervix is higher, low, softer,
and
firm.
how it feels, My method that I teach doesn't use that sign.
Oh, okay.
A lot of women find it difficult, and then there's a few women who find it really helpful. So it really varies.
Depends on what works for you and
what
you want to do. The basal body temperature method, that's showing you 2 main things. It's showing you when you've ovulated and when you start a new cycle, because of those dips in change in the temperature. I also, we were talking about this before we started, the daisy. Excuse me. The daisy is that one I found kind of popular.
Isn't that a smart thermometer?
Yes. Yeah. And you just stick it in your mouth, and it tells you, takes your temp. I don't know what all it's doing, but it tells you when your fertile window is and when you're not fertile.
I think it looks at subtle variations in the temperature to find ovulation. Because typically with the basal body temperature, it's only confirming that you did ovulate in the past. So what happens is when progesterone rises after ovulation, it causes the body to warm up. So women, their waking temperature, the basal body temperature will be a little bit higher, and so they'll be able to see that shift in temperature from lower before ovulation to higher after. So it can be helpful in confirming that ovulation passed. And then if you see a higher temperature that's sustained for a long time, you can confirm pregnancy that way even. But in terms of trying to get pregnant, the basal body temperature alone doesn't usually allow you to identify when fertility is starting. Does that make sense?
Yeah.
It's like a retrospective thing.
Good.
So I think
Good
that
to know.
Daisy looks at other cues in order to tell you when you start to be fertile, as well as when it's passed.
That's good.
Yeah.
Good to know. It's like $300.
Yeah, a lot of these devices are kind of expensive. But
Yeah. It says it's 99% effective though. So
Yeah.
I don't know. There's also the Ava.
Yeah, it's a bracelet that you wear at night. There's lots of new kind of femtech items out there that are designed to help women kind of navigate this. Most of them are especially indicated for trying to get pregnant. It's hard to get FDA approval for something to avoid pregnancy. The Clear Blue monitor is another one that people use, and that actually measures urinary hormones like estrogen and LH, which rises right before ovulation. And then there's even devices that can help you with taking your temperature, like that you wear all night. It's called the Temp Drop, and you wear it on your arm while you're sleeping, and it will kind of tell you what your temperature is in the morning. So,
Interesting.
yeah, there's lots of things that can help couples with this. I'm kind of biased as an instructor that I think one-on-one instruction that's customized to a person is also going to be really a lot more helpful than just buying something on Amazon and starting to use it and it not working after a few months and deciding it doesn't work.
Yes.
Yeah.
Yep, absolutely.
Yeah.
So then there's also the Billings method, which my understanding is Creighton is kind of a more
Well, Creighton actually began as kind of researching the Billings method. So it uses cervical mucus alone, and it kind of allows a woman to define her sensations and what she's observing herself. But it's highly effective as a method of natural family planning. It's taught in the St. Louis area, I think at Mercy South now is what it's called. So Creighton model developed as kind of a standardized modification, is what we say, of the Billings ovulation method. So then what they found was that they would talk to women who were charting with Billings, and one woman would say my mucus was stretchy, another would say it was stringy, and someone would say it was creamy, and they were all kind of meaning something similar, but no one could get them on the same page. So they developed the method based on the need to standardize really how the mucus was described so that it was more obvious and kind of understandable for women to use on a daily basis. So Creighton model was developed in the late 70s, early 80s, actually started in St. Louis. So
interesting.
That's exciting. And there was a group of founders that, again, were researching the Billings method. And the way they standardized it is we look very specifically at bleeding patterns. We look very specifically at the mucus pattern. And because of how they did that, they were able to then research kind of the patterns they were seeing, because we have such an objective notation for what this kind of peak mucus looks like. We can then measure what a normal mucus buildup should look like. And then we can see, okay, is her mucus limited, objectively speaking, like is she having less mucus than she needs to be fertile? Or is it really adequate and she just needs to make the proper observations to see that, and then it's not a fertility issue. So Creighton model is really highly effective to avoid or to achieve pregnancy, but the way it was developed is helpful in identifying those patterns.
That's very interesting.
Yeah.
I find it really interesting, especially because, people like you are, you not only are you helping people learn how to track fertility, but also, the underlying health issues that can come, like, with learning how to do this. Like, it's so empowering to know what's going on with your own body, instead of, like, you take a birth control pill every day, you don't really get to know your body. You don't really get to know your ebbs and flow and, how you're changing throughout the month. And it's just enlightening and empowering, is what I've discovered.
Right, because then you have the chart too, and if you need to go to your doctor with a problem, you can say, no, really, I am having this bleeding in the middle of my cycle, or the PMS is lasting for 4 days before my period starts, or my periods are 10 days long. Because sometimes women go and they don't feel listened to, like, oh, everyone says they have bad cramps, or everyone says they're bleeding for 10 days, and it's probably fine. But when you're charting and you're confident in what you've observed, you can say, no, there really is something that I think needs to be attended to here, and you can demand that kind of care.
So patients of mine who are struggling with achieving pregnancy, I encourage them to pick a method, Creighton, I like the Creighton model, and get some tracking done.
Yeah.
And then, I had somebody the other day who doesn't have an appointment until April with a fertility doctor.
Yeah.
So I thought, wow, it would be really great if you could start doing this.
Definitely.
And bring that to your doctor. I don't know if all doctors look at these
Yeah,
things.
not all doctors really necessarily understand how to interpret the chart. The doctors where I work at Little Flower do. They're trained in naprotechnology, which is the women's health science that goes along with the Creighton model chart, so they can really identify those patterns and develop treatment based on it. But you're right that it is really important and helpful to learn how to chart your cycle. I mean, I've had clients who come in with a history of not being able to get pregnant who, from just charting and being able to target their fertile window, they're able to achieve a pregnancy in not too long. So sometimes that is also part of the formula for different couples in getting pregnant is just knowing when they're fertile. But in terms of learning the method, the Creighton model is taught in one-on-one sessions, and so I find that really helpful in both being able to teach to whatever people's needs are in terms of understanding, as well as identifying those what we call biomarkers on their chart. So we teach a series of follow-ups, and usually the earlier ones are, okay, here's what mucus looks like, here's how you chart it, here's the routine for observing the mucus, because it's not just whenever I feel like it, I'm going to kind of check.
Yeah.
You need to be fairly diligent to be able to catch it, especially if you have more limited signs. So the first few follow-ups are really getting that nailed down. And then we have data on the chart after about 3 months where we can then start to see patterns, because one cycle where you have this kind of weird mucus is not a pattern. We need to look for patterns over time. And so once we start to see those patterns, then I can send a client very confidently to a nephro doctor who is able to look at their chart and say, okay, yes, you had PMS, it lasted this many days, you had this mid-cycle bleeding, you had brown bleeding at the end of your period, you had all these kind of concerning signs, here's our treatment plan. So usually it is that there's an investment up front of time in terms of learning how to chart and then charting.
Time and diligence.
Yeah,
right?
It does take some diligence, which can be difficult, but
once you get it,
it's not rocket science is what I tell people. And my job is to help them troubleshoot. Like, it's about habit formation and, just starting those routines of checking. Okay. And I found myself with different health issues that having someone support me in developing those habits makes it a lot easier. So instead of just taking a book and saying, oh my gosh, now I need to check my mucus 18 times a day, I can clarify for you when exactly you need to worry about doing that and how to build it into your routine where it's not this insurmountable obstacle.
That's good. Yeah. So it's really helpful to have somebody that's, one-on-one.
I found it that way personally, and I think my clients do too. So
great.
Yeah.
So I have some questions here for Rachel. We might have already answered.
Yeah, we're kind of going through a little bit here.
We are.
Yeah.
So how can someone who's interested learn it? And we already talked about the process a little bit.
Yeah.
So they can contact.
They can contact us at Little Flower. There's lots of different centers around the St. Louis area where they teach the exact same thing that I teach.
Okay. Churches too?
There's some at churches. A lot of them are actually affiliated with hospitals or in a office near a hospital or different medical offices. So can contact any of us to learn the Creighton model. It's taught through an introductory session, so it's kind of an old school PowerPoint that we go through. It takes about an hour. Gets everyone on the same page, and then after that we do the individual one-on-one follow-ups where we just start charting, and then we kind of coach you through learning the method. So to be fully instructed takes about 8 follow-ups over the course of a year typically.
Okay.
Yeah.
Great. When should a woman or couple considering trying to get pregnant begin the charting?
Yeah.
I mean, early.
We kind of started talking about that, but I think everyone should chart, so I'm kind of biased that way.
Okay.
I think it's best to start charting before you're gung-ho about getting pregnant.
Okay.
Really, when we teach the Creighton model to help people learn the mucus pattern, we actually recommend a couple abstain from genital contact during the first month of charting. So especially if a couple's ready to start trying, they don't like to hear that. So there's a warning for couples. But identifying those patterns and then addressing them and maybe treating any underlying issues is going to make a couple much more successful earlier on. So if you do that effort before you even start trying, you're in a much better place.
Gotcha.
And then the other thing with the charting patterns is they can indicate hormone problems that would not only affect trying to get pregnant, but pregnancy. So if you have low progesterone, we can see that on your chart, and that puts you at an increased risk of miscarriage. So if we have progesterone starting before you even get pregnant or find out you're pregnant, then that's going to decrease the risk of miscarriage, and we do that a lot in our practice.
That's great. Wow, that's really good. How can charting with Creighton model be helpful at identifying health issues that a woman might be experiencing that could affect fertility? We did
we
mention
kind
that.
of touched on that.
Yeah.
But there's different patterns of biomarkers that we look at or that we look for on the chart. So once there's several cycles of data, I can look for, like an example would be that mucus cycle. So the window of fertility is really 6 days, the 5 days leading up to to ovulation. That's really the fertile window. That should be indicated by a good mucus cycle. So you should have a changing, developing pattern of cervical mucus. So you notice it when you go to the bathroom usually. Maybe while you're walking around during the day, you'll notice that lubricative sensation or maybe a slippery sensation. We base our observations like on bathroom visits. So you would notice a changing, developing pattern of mucus. It should last about a week, not super long, and if it's shorter and more scant, that can also indicate issues. So once a woman has charted for a while, we can see her mucus cycle, and we actually do like a calculation to score it. So we can compare it then to kind of the research we have about that mucus cycle and how it should look. So that's one biomarker we look at. Limited mucus affects fertility, obviously, because mucus is necessary for fertility. But then the bleeding pattern with the period itself, like the period should not last longer than a week. A healthy period is 3 to 5 days with a good crescendo and a decrescendo bleeding pattern. You have a nice moderate or heavy flow. You shouldn't have a lot of brown bleeding at the end of the period. It shouldn't trail off for days of brown and light spotting. So once we start to see these patterns on the chart, we can call attention to them and then talk about like the possible causes of that, and then get some support for treating them. So,
that's so amazing. It's so interesting. Now, what about, so in St. Louis, a lot of allergy issues. Like, so all the women that are, men and women, honestly, everybody takes allergy medicine.
Right.
Can that impact?
It can affect cervical mucus, but some allergy medicines don't. So, I mean, if you're taking like Benadryl every day, that tends to dry up mucus. Between like Allegra and Zyrtec, I've seen some effects and some haven't. Flonase is not really going to affect your cervical mucus. So sometimes it's talking about, well, maybe you should tweak what you're doing here, or talk to your doctor about other options in terms of treating allergies. There are things that can affect the cervical mucus observation, and we track at every follow-up, like what are you taking, to see if that might be playing a role. So,
And we help a lot of people with allergies in our practice. So if you have allergy
find
issues,
a better way to handle it.
Yes, there's other ways to handle that naturally, for sure. And then can Creighton be used by women who have irregular cycles?
Yes. So that's the thing about really any of these methods, what we call modern methods of natural family planning or fertility awareness-based methods, is they're not based on assuming that everyone has a 28-day cycle and ovulates on day 14. Because we're looking at your cervical mucus pattern developing, that's only going to happen when estrogen's rising. So it's going to give us this predictive look at your cycle. So it can be used in whether you're ovulating or not, actually, because what pattern you're observing when you go to the bathroom would indicate you're not ovulating. Women can use it between pregnancies, so postpartum, if they're breastfeeding or not. We can kind of monitor the return to fertility after a baby is born using the Creighton model. So all of these methods can be really helpful regardless of your cycle pattern. So, and actually it will help identify why you're having irregular cycles in a lot of cases. So it's really useful.
That's really great. So this is all just such good information for people who, you know, are thinking about getting pregnant, or maybe you're not having success getting pregnant. It's just something that, you know, we might be doing everything right in our health, but we might just be off.
The timing might be off, or there's something we haven't noticed or kind of connected yet, and this might be an important part of connecting those dots.
That's really great. So I would think with any of these methods today that we talked about, Creighton included, some of the issues would be not being consistent. You know, if you're not going to be 100% consistent and diligent, then the effective rate is going to go down. Right. So that's obviously
you need to have a full picture of your fertility, regardless of whether you're trying to get pregnant or avoid getting pregnant. So And that's, again, the role of instruction, is to help people understand how they're actually using the system. So if I have a woman who's sitting with me and she's been trying to get pregnant for a long time, but she's only observing like once a day, and we can't really tell what her pattern is on the chart, the method's not going to be very helpful for her in trying to get pregnant. By the same token, a woman who is trying to avoid pregnancy really seriously, who's not attending to the observations, is not going to have the full picture upon which to make decisions about having sex or abstaining from sex in order to avoid pregnancy. So it is really important, but it's also something that I think we're all capable of doing. Sometimes, there's tough things that happen in life where it's difficult, but usually with like good support, just like making diet changes or deciding we're going to take certain supplements, when we decide to add them to our routine, if we get the right support in doing that, we're capable of doing it.
Right.
We're women, we can do it.
We can do this. Yes,
Yeah.
Absolutely. That's great. Now, is there any books on Creighton, or is it more you have to go to the practitioner?
Yeah. There's some books that you can read kind of about naprotechnology generally. There's one, it's The Naprotechnology Revolution. It's on Amazon. It's kind of expensive, but they go through different issues and explain how the chart can indicate them. But in terms of learning it, Creighton model is really an instructor-based method,
Right.
so you need to go seek out an instructor who can give you that information and really tailor it to your needs. But there's lots of good books about fertility awareness.
Yeah.
Some classics out there. Yeah.
Right.
Yeah.
Taking charge of your fertility.
Yeah.
I read that a
That's
long
a classic.
time ago.
Yeah.
When I didn't have a period for 5 years almost, I read that, and it was just really good. It's easy. It's comprehensive. It's just a good introduction to family awareness.
I would say that's great for a lot of women to get introduced to it, and then maybe you are one of those women with regular cycle and you're capable of reading a book and doing it. I also get a lot of clients who have been charting with another method for a while, and then they want some more like fine-tuned support, and so that's where it's good to turn to an instructor too. But
Great.
Yeah.
That's great. Well, I think that covers everything I wanted to talk about. So hopefully that was informative, and you guys learned a lot from Rachel. This was great having you on. I appreciate it. I will make sure that I tag Little Flower in this, so you guys know how to contact her and get in touch with her if you're interested in more one-to-one instructor-based fertility help. But again, this stuff starts really, really young. Our fertility issues start when we're little, so if you're a woman going through issues, just keep that in mind for our children. And at some point they're going to be of childbearing age, and hopefully they don't go through they can have a smooth transition into their period, and then all the way in through their childbearing age, and fertility and is easy in that how it's supposed to be. So if you guys have any questions, please do not hesitate to reach out. Hopefully this was a good topic to talk about and address some issues. And we will see you guys next Friday with Dr. Emily. Have a great day.
Thanks.